Good morning. I wish to thank everybody for the opportunity to come to speak with you all. It's an interesting timing deal for myself. My father is going through treatment for lung cancer, stage 3, and I'm going to learn a lot of good information while I'm here. Okay. So where do I belong? So VHA National Data Systems, for those of us in the VA, fall under Gail Graham's leadership, Office of Analytics and Informatics, on down to Marsha Inslee. And National Data Systems is headquartered out of Austin, Texas, where the AITC is located. We have staff there, and we have other virtual staff, myself included, across the country. Before I get into the next slide, just a little bit about corporate data warehouse and what I'm going to cover. There's a lot of data there. So if you've seen those commercials with Captain Obvious there on the hotel advertisements, that's going to be it. There's a tremendous amount of data in the corporate data warehouse. Okay, overview, data collection and content. We'll go under some of the understanding of CDW with the metadata and other support, and then data access processes. I know there's a keen interest in data access on how we get the data for folks, and I know in this arena there's a big need for the research side of the cancer studies. Disclosures, I have none. Okay, so let's get into data collection and content. So whenever you have a lot of data, it's a team effort, so there's a tremendous amount of information, as I mentioned, and when that's in place, you have a need for data governance. So listed here are some of the organization and groups that we have to manage some of the data enterprise-related initiatives that are out there. VHA Data Consortium is a big organization that has folks from different program offices working on data and improvements and implementations. The big one here is the CDW CDW Governance Board. And this body are the ones that determine what domains get implemented into CDW, how it's managed, what priorities are in place, how do they get implemented, etc. And you can see the other ones on down the road. There's a lot of information that's covered in these forums, and the goal is to make data available for folks to do their jobs. Okay, this is a pretty busy slide, but our friends at OI&T manage IT systems, of course, and they helped us put together some of this on the IT side. So on the top, it shows some of the information on the data. So it's clinical, administrative, financial. So there's a robust amount of information. It's not just limited to research. It's for operational purposes as well, as mentioned. There's different tools, standardized reporting, there's raw data, there's production data that's more structured. So we have some variance there. Some of the statistics that I mentioned earlier, where you can see that there's a tremendous amount of information out there. We have 63 domains, and what that means is there's different packages within Vista and different pieces of information to study there. We started with a charge from Dr. Petzel in 2009 into 2010 to implement 20 domains. So we've added upon that in those work groups that I mentioned on which priority levels need to be considered. Rows of data, 900 plus billion rows of data. Columns, 22 plus thousand. Tables, you can see there, and users a month is 30,000 plus. So we provide access to many users, and then they come in and come out and use it for different purposes and different studies and different operational needs. Data examples we have there in the lower corner, 20 million unique veterans, 1.6 billion outpatient encounters, and you can see the rest there. Labs is another big one. You see 5.6 billion. Analytic capabilities, primary and secondary data mart. We have standardization within the environment, metadata services. So what does the data mean? Different quadrants of information. You know, what are you looking for? And here's some of the definitions that some of the data elements have. Business and reporting tools, as well as we have SAS Grid. So different ways to look at the data and use the data. So So here's an overview. How does the data get into the system? So as we know, there's many systems out in the environment based on regions. So all the local Vista systems roll up to the regions, and then they form the data into structure and put it into the Austin Automation Center, AITC, Automation Information Technology Center. So there's an enclave in Austin, which is the circle at the bottom, that has the environment for the corporate data warehouse. Here there's many servers, there's many entities in place to manage this. We have security from OINT involved, of course, with getting the perimeter security set up. Our Office of National Data System manages the access to the data, so there's an approval process to do that. And then we have partners to do different things like Vinci getting the data. We have other offices that are involved, OINT, a big one, obviously. You see on the other side, corporate, the governance boards, as I mentioned. So anytime there's an introduction of data, whether it's new, whether existing, on how it's managed, these groups are involved, and the data goes in Austin, and then there's a process to retrieve that information. Some of the content. As I mentioned, there's a CDW production and then CDW raw. So unstructured data and some structured data. For this environment, you'll see on the side that we have oncology on the CDW raw. So I know there's been recent movement on some of the registries that need to be added. As I mentioned earlier, it's a prioritization on how you get information there, just because there's various needs across the environment. But we're really proud on the work that the team has done to try to get more information available. One thing I wanted to mention, I think on a previous slide, is the folks in OINT are telling me that the amount of data is doubling every 18 months. So all those rows and tables that I mentioned, the curve is upward where it's doubling 18 months. That's quite a bit. Understanding CDW, I mentioned the metadata and other support. So there's a slide here on how do you get information on the content. So there's a SharePoint site that's set up. You have the electronic versions of the PowerPoint, so you can go to these sites. It displays the information about the data, the organizations that it involve, relationship diagrams, etc. Frequently asked questions. Anytime there's a new question or new initiative that we don't have covered, that's added to the SharePoint site. User account privileges, information is there as well. The important thing is documentation generated by domain teams. Anytime there's a domain introduced, there's a need to identify what that means, how it's useful to the environment. So some of these definitions are listed there, and any general announcements. HSR&D listserv, I think a lot of us are aware of that. A lot of information comes from that media as well. Search the archives is a good idea if you're looking for information. And then there's Business Intelligence Service Days there to go over information regarding the data. Data access process. So that's what my office manages. We have oversight with approving and authorizing access to the data. As I mentioned, it is a team effort, though. We have folks in BIRAC that help us on the research side, Vinci on the IT side and the analytics side on getting some data to people to get their jobs done, OINT obviously. So really big team effort here. Okay, so what do we approve in national data systems? Here's an output on some of the data sources that we have. Managerial cost accounting, formerly called DSS. We have an agreement with them to approve their data as far as requests coming in. MedSAS inpatient, outpatient data sets. VetsNet's another one here, and you can read the rest on that line there. So a lot of content in CDW, but outside of CDW, we also approve mainframe access down at the AITC. So if somebody wants data that's on those systems in Austin, there's a process for getting that, and we approve that. VSSC web reports, as I mentioned, MCA in coupling with that. So a lot of people are requesting information that's in a web format. The VSSC has a nice tool for that, and then we get the process for the authorization piece. Capri and Vista Web, those are access to the electronic health record, and that is at the enterprise or national level. So if you have a need to see data at 2 different facilities, our office manages the access to that. If you need it locally, you just go to your local hospital to ask for access. If you need it at all facilities, we could do that as well, and my office manages that. HACE, that's another biosurveillance influenza group that we manage the access to, so they're using a process that we have in place to get access to that type of data, OEF, OIF, roster information. This is an external data source that we manage as well. So pretty robust amount of information that we manage. Some of the statistics that we have here, so this is operational data, and I'll get to the research side after this. So the examples that I gave earlier, CDW, the mainframe, web reports, etc. This is a view that we have fiscal year 14, and I think this is a few months old, but we have about 2,500 different requests that have come in on these various data sources that we manage. You can see that Capri and Vista Web is one of the higher ones, followed by CDW. The Capri Vista Web ones, as I mentioned, it could be somebody asking for 2 facilities, or it could be asking for 100 facilities. Just varies there. This is the research side. So some of the data sources are listed here involving research. And one of the things I wanted to emphasize today, that we're getting a lot of information to researchers. I understand there are some issues in some areas as far as the timing on getting some of those, and there's different reasons for that. But we are providing a large amount of data for research. So this is a graph that just shows the trend here. And this is research as well. So the green on the top is the glide path for the current access request for research. And we've already surpassed last year with the numbers going through June. So we have a whole quarter of data to analyze coming up at the end of this month. And we're certainly going to surpass, we have surpassed last year, but we're going to significantly surpass it based on the numbers I'm seeing. So this is really important. We need to get people data to do their jobs. So we're always looking on efficiencies on how to do it better, but we are getting data out there compared to previous years. Some general information. I'd welcome anybody to get with me today offline. You can send me an email if you have a research study that you're working on, that you need information on, or you're waiting to get one through, or you need information on how to go down the process. I'd be happy to cover that. I know our panel members will talk about any specifics as well, but I'm here, so come get me. I'll be available anytime.